Hello and welcome to this episode of Transforming Healthcare, the people behind the progress. My name is Joyce Shaw and today we are joined by Loretto Grogan, National Chief Nursing and Midwifery Information Officer. Loretto has played a key role in bringing the clinical voice to the centre of our digital transformation. Today we hear more about that journey. Loretto, thank you so much for joining us today. Loretto, you've worked across many parts of the health service. Could you start today by telling us maybe a little bit about your current role, what inspired you to take on this national position, linking nursing, midwifery and digital transformation?
Sure, Joyce. So my current role is the National Chief Nursing and Midwifery Information Officer, and my role is to provide strategic leadership and direction for digital health for nursing and midwifery in conjunction with my multidisciplinary colleagues. So what inspired me to take the role, I guess, is coming from my past experience. So I would have worked across a number of services, acute and community services in various roles, from staff nurse up to director of nursing role. And I also I did an undergrad in information science and a master's in health informatics. So data and information was always something I was really passionate about, and having the right data and information at the right time to provide the right care. But I'd also worked as a researcher and in the area of epidemiology. So I would have seen where that secondary use of data was so important. And I also would have spent some time working in pharmaceutical research. And again, I would have seen how that data was so important from the perspective of even recruiting patients into trials and then actually managing the data and the data required for safety while the patients were participating in those trials, and from the overarching outcome. So I can see how that's just so important. And the biggest perspective is that technology is here and health is here, and digital health is multifaceted and is complex because you're bringing technology into health. And my biggest learning in my role is that collaborative piece. It's working together. It's, the technologists, we're health, but it's actually bridging that gap and making sure that we have an enabling, everything from enabling relationships down to enabling infrastructure, policies, etc. And they have to cross both.
Loretto, how do you feel your work aligns with the Digital for Care strategy to 2030? What are the key intersections between nursing and midwifery and the broader digital strategy?
So the Digital for Care strategy is our national vision for digital health, which is a really positive place for us to be. So obviously Digital for Care, the strategy was launched by the Minister in July 2024 and a corresponding roadmap. So I would see our intersection very much as, nursing and midwifery certainly are one of the biggest end users of Digital for Care. They're also they're on the front line. They're probably the biggest enterers of data, the biggest users of data, and they have such an important interface with the patients. And Digital for Care, as we all know, patient as an empowered partner is at the centre of all those 6 principles. And I would very much see that nurses and midwives working hand in glove with T&T around key areas like designing our systems, implementing our systems, and then optimising our systems to make sure that we have optimized what we're doing to provide good patient care, and also that the workforce have a good experience. That's really, really important as well. And then that we have for our nursing leaders, whether they're in Rachel Kenna in the Department of Health or Geraldine Shaw in the OMSD and other key leaders like in our regional directors of nursing and midwifery, that they have the right data to plan care and to plan for the profession.
Loretto, what are the key foundational aspects required from nursing and midwifery perspective for the success of the Digital for Care strategy?
So the key foundational aspects would be around clinical data and documentation. It would be around workforce. It would be around good governance, and it would be about nurses and midwives having the right tools or solutions and systems to enable them to do their job. So from a clinical data and documentation perspective, the standardization of that clinical data and documentation so that we have good standards. So that information, when someone's looking at it, whether it's in an integrated care hub or whether it's in Beaumont Hospital, that the information has the same meaning, and the same meaning at the point of care, which is really important and where it matters most for us as clinicians. And to enable that, Again, it's agreeing, putting structure in place, understanding where our data is, agreeing common standards, and then obviously the use of coding is absolutely essential. So clinical coding, like working with Teresa Barry in terms of applying that coding, whether it's SNOMED or any other coding that is relevant, but developing out those standards is core. Then from a workforce perspective, it's really important to have the right people in the right place at the right time, doing the right thing to enable the implementation and ongoing optimization of systems. And a lot of those people, some of them have to be in strategic roles in the centre, but the majority of those staff have to be in the regions. They have to be on the ground where this matters most and where implementation happens. And again, a core part of that is the right governance, so that we have clinical governance, and it's enabling clinical governance around everything that we do. And that governance is to enable things to happen in the right way and in a safe way, but it's also to highlight when things aren't safe or they're not being done correctly or there are concerns, so we have escalation points. And again, another core foundational piece is the digital health clinical safety, that we have a really robust infrastructure, that people have an understanding, and that everything we do is safe. So they would be the key things, Joyce. And also that we have a communication network set up. So when things are going well, it's great and we can share that learning. But also when things are not going so well or they need to improve, that there are both communication and escalation points and systems in place to manage that.
Loretto, what strategies have you found effective, around fostering trust and collaboration between clinicians, nurses, midwives, and the technical digital teams? Are there lessons learned maybe that you could share?
Sure, Joyce. So I think one essential piece of that jigsaw we now have is that unified vision. So we have a vision, and Digital for Care has given us that vision, and it set out those 6 principles and those 48 kind of key initiatives. So everyone understands that. That's a core part. So we all know what we're working towards. I think outside of that, from a clinical perspective, the trust piece is huge. Building that trust. And also it's not about that, it's about building the respect for the roles. And as much as I've said about digital health is multifaceted because you've got technology and the health, but it's the same for the human factors. So clinicians work in clinical environments. Our T&T staff are very kind of technical facing. And it's about building those relationships and actually putting those key roles in, like mine and other roles, that can actually cross that divide or that can bridge that gap. That's absolutely fundamental. And it's about listening. And again, that's not an amazingly, new strategy, but we need to listen to our technical colleagues. They need to listen to us. We need to build that trust and respect, but we need to understand each other's roles and what our responsibilities are. So I think the service, the HSE is a large, complex service with amazing people working in it. They're our biggest resource. But from a digital health perspective, it's understanding those roles and responsibilities, being very clear about what we're going to do, being very clear about what we expect of people that are in the roles, and being very clear of what this change is going to mean to people. So that change management piece, and being really open and clear around, this will change your practice, this is the opportunity it'll bring, these are maybe some of the limitations with it. So it's building the trust and respect, having those key roles in who can bridge that gap, and also taking time out sometimes to step back out, look in and go, right, what are we doing right together? And where are the areas that we could improve together? Because we're not a digital first organisation, we're moving towards being one, and not to be too hard on ourselves, that we're on a learning curve. And so I guess just to take that time out to reflect on what we're doing well and what we could do better.
In your role, Loretto, how do you balance local innovation or customization, meeting unique service needs with the requirements for national consistency, standards and governance?
So currently, Joyce, in the role, we know we have a lot of, probably well over 1,000 smaller programs of work or projects or systems and solutions. And we also have then innovation calls. So there's innovation calls come out from a number of places. So in my role is trying to set context for people. So making people aware of currently if you're looking at an innovation and you want to bring in a digital innovation. So I've got, I would say well over 100 calls going. We've got smart funding to bring in a smaller respiratory system. And I guess my role has been about, putting a structure in place and very clear information. If you're bringing this in, this is what you're going to have to do to bring it in safely, to bring it in under procurement rules, to bring it in so that it'll be maintained and optimized, linked to the service desk, etc. So it's not necessarily to put a big fist down, but it's to make people aware if you're doing something, this is what's required to actually bring it in the right way and safely. So I think probably colleagues then would look and go, well, maybe that's just very complex. So it's making them aware of the process. But yet there are some really good innovations. When I get those calls, then I try and turn it around and go, well, if you're looking at that, maybe you could look at developing out a minimum data set for respiratory care and see if there's some way that we can actually make it more enabling instead of saying, no, this is something you could do. So a lot of it is awareness setting for the organisation, because people want digital, they want the right tools, but I guess because, again, and we can't work backwards, not digital first, there's probably a lack of awareness in terms of the right thing to do when you're bringing in innovation. But yet you want to make sure that innovation is there because it's a really important part. So in terms of, if you're not getting the system, then there are people, there's change, there's data, there's other really key enabling things that you could be doing. And we work very closely with Spark around that now.
Loretto, in practical terms, can you think of a project or projects where embedding better data standards or digital tools or clinical systems in nursing and midwifery have delivered measurable benefits?
So I guess the two that automatically come to mind, Joyce, are the maternal and newborn, the clinical management system, programme of work, and the virtual wards for acute patients. So the maternal and newborn definitely has delivered measurable benefits for patients, for the mums, for their babies, and for the workforce in terms of seamless, the data that they have, the care that they can give, the clinical decision support that's built in, and then even for the patient app going live, that they could go live in maternity services because the maternal and newborn was there and they had the data. And again, the feedback from the mums who had the app on their phone was fantastic. Being able and being empowered to manage their own health. So another example would be the establishment of the virtual wards. The virtual wards are a safe way of managing patients' care in their homes with a ward that is staffed as it would be like any other ward, managing those patients under the governance of the setting that they're in. So 2 wards were established last year, one in St. Vincent's and the other in UHL, and with their capacity for 40 patients. So those wards have been amazing for the patients. They can receive care in the place that they call home. And the feedback that we have gotten from patients to date is that there's 98% satisfaction with the wards and with the care that they are getting at home, and also from the people that are at home with them if they have a carer or their family. And it means that they can receive care, like I said, in the place they call home. But I guess what's so important is that there was a very kind of structured, safe process around the establishment of those wards. And that was done with multidisciplinary or transdisciplinary teams, because the core clinical staff, the administrative staff, the operational staff, and there was a huge effort put in to make sure those wards were established safely. And that the biggest part, I guess my biggest learning from that, and the best part that we did, was at the beginning, we mapped out the patient journey from when they were referred into the ward, from when they were managed and monitored in the ward, if care needed to be escalated, they were going home, discharged, and we built around the patient. So that ward really was designed, developed, built, and now optimized around the patient and the care that they require, and the requisite standards were put in place.
One of the risks often noted is that digital transformation adds burden or extra work to clinical staff. How do you guard against that, and what supports or design principles do you insist upon to avoid that pitfall?
So I guess one of the biggest principles, and it is written in Digital for Care, is that programmes of work are clinically led. So clinicians know what's required in their clinical services. They mightn't necessarily know all the technical aspects, but ultimately, much of what we deliver goes into the hands of clinicians to provide care. So one of the key design principles is always to ensure that the system is safe, that there are clinicians involved at every aspect from ward to board, and that we're not overwhelming them. So change is every digital system, whether it's a smaller system or it's an electronic healthcare record, means change. It means change in practice. It means change in terms of how we engage with patients sometimes, whether that's virtual care or, like I said, you've got now, instead of your pen and paper, you've got a wow in front of you. So it's involving clinicians in every part of that step. And it's the design principles we need to build around the patient, and the workflows, the data and the workflows to get systems right are absolutely essential. So if we have a workflow, and your workflow might not always stay the same, but involving clinicians and understanding if there's a change in workflow, how is that agreed? So the clinical governance around all of that is absolutely essential. And like I said, the involvement of the clinicians from ward to board, but also the involvement of patients, because ultimately clinicians provide care to patients. We're a health service. That's what our health service is built on. And then we have our operational colleagues, obviously, who are working really hard to make sure that our health service is operationalised. So it's involving all of those key stakeholders. And the design principles, ultimately, those workflows and the data in those workflows need to be designed so that it'll help us optimise care. And the design principles should be, if you are now taking longer or it is more complex, when we put a system in, if it's taking longer and it's more complex and it's added to the burden of documentation or managing data, then I think it's almost like a stop sign is warranted. That's one thing that we can't happen. And I guess we are regulated professions. So in our regulations, we have document in one place. There has to be a single source of truth for patient care, because if we miss data, or if there's paper and there is data and we miss a key piece of information, we lose our registration. So we're regulated professions. That means if that happens, we can't work. And I think sometimes there's a misunderstanding in the organisation in terms of that piece. So it's the information at point of care where it matters most, that it's there, everyone understands what's happening, and that we design in a way that it actually improves what we do, not adds to the documentation burden, which we know is really significant at the moment.
Digital inclusion and ensuring vulnerable populations are not left behind is increasingly important. How does your work anticipate and respond to equity, access and inclusion challenges, Loretto?
So, Joyce, firstly, that inclusion piece is so important, even from the perspective, so we know there are groups that are automatic, whether it's digital or not, are on the periphery sometimes of our healthcare system. So that's people who mightn't necessarily have access to digital, or they mightn't even have access to care. And so that piece is kind of fundamental to ensuring that we have an inclusive system. So I think it's asking the population, from literally, we have an EHR that's coming, and it's a record from birth to death. Now we can't ask a 3-month-old, but in as much as we can, asking, what does inclusion in digital health look like? What does it feel like? And what do we need to do to make sure everyone's included? And then we will really understand. And again, like I said, getting those hard to reach groups, like people that are homeless, that we know hugely use our health services, both our community and our hospital services, getting to work with those around how could we make this better? Are there better, digital health opens up that preventative space hugely. So it's working with them and also working with other colleagues. So like asking our colleagues in public health, our GPs, our nurses who are actually our AMPs and CNSs and other nurses who are in the community and GP practice nurses, who would you feel how do we need to do better on the inclusion front?
From your own perspective, Loretto, what do you find most rewarding about the work? What keeps you motivated through this period of transformation?
So what keeps me motivated, Joyce, is again that we have a vision, and if we can deliver on that vision, that really does keep me motivated. Or what keeps me motivated is when we see the systems and solutions that they make a difference to patient care, that they make a good difference to patient care, that they the workforce experience of using digital tools is positive. And again, I would use the virtual ward as an example. That is a really rewarding experience. Again, what would motivate me is the people that we have in the health service. We have amazing people working in the health service, both in technology and clinical colleagues and other administrative colleagues. And they motivate me consistently. Ensuring that I can get the right tools and solutions out there, and plus that feedback. So we've just set up an engagement forum for nursing and midwifery, and the whole purpose of it is, what is the right thing for you? This is coming. What do we need to do? And having that feedback loop, so you're hearing from the ground, because sometimes in strategic roles, it's easy to lose touch with the ground, and that's where all of this happens. So that's a major motivator for me, is actually making sure that people on the ground have the right tools to do the right thing in the right place at the right time. And a major motivator for me is I've seen where good data can really improve care. It can really improve planning. It can really improve how we formulate policy. So that's just a huge motivator for me in my role.
Finally, Loretto, if you had one message or challenge maybe for frontline nurses and midwives today regarding digital health, what would that be?
My message would be, get involved. This is your journey. Work with the system. Understand what's happening and make sure what's going in. You know your service and patients better than anybody else. Make sure that what's going is safe. It's safe for patient care, and it's safe for you as the regulated profession who's providing that care. But like I said, get involved. This will make everyone's lives better if we do it the right way around. And if something doesn't look good, stand up and say so, because that's okay.
Loretto, thank you for sharing your insights and experience with us here today. We really appreciate it. Thanks for joining us today. Make sure you follow us on all our social media platforms to keep up to date with what's happening in the world of digital transformation and digital for care.